Hi, I'm Jen Binstock-Risky. My presentation on self-care and nursing. The reason why this is so important is that unfortunately one of the occupational hazards of nursing is post-traumatic stress disorder, or PTSD. It's estimated that up to 14% of all nurses suffer from some form of post-traumatic stress disorder, where the general population is at 4 times less. For those of us that work in specialty areas like critical care and emergency room, those rates even go higher. 25% for critical care and 33% for emergency room. That's attributed to increased exposure of mortality, morbidity, and trauma, especially those in specialized populations like children, the elderly, handicapped, and pregnant women. PTSD can take on many forms. It can be insomnia, anxiety, hypervigilance, loss of interest, self-isolation, depression, flashbacks, fear, increased use of alcohol, even drug abuse, and unfortunately, it can lead to suicide. Nurses are at a higher risk of suicide than your general population. For female nurses, it can be as high as 11.9 per 100,000, and for male nurses, it can be as high as 33 per 100,000. Whereas respectively, your general population for women is 7 per 100,000, and males is 27 per 100,000. This presentation will touch on different ways that we can perform self-care for ourselves and risk factors to be on the lookout for our co-workers as well. Especially right now in COVID, where we're not able to have as much contact with friends and family as what we may be used to, it's really easy to go into a depressive self-isolation mode. We have to take into account that we're working short-staffed, we're watching our friends and family become ill, and our patients are at a higher rate and increased acuity. So now is more important than ever to take care of ourselves and to take care of our staff members and our families and friends. I hope this presentation helps, and stay safe, guys.
As nurses, we are taught to care for others. However, sometimes we forget to take care of ourselves. We are so focused on patient-centered care and doing everything we possibly can to make sure that our patients are comfortable that we often forget about our own needs. That includes taking breaks, eating lunch, or even going to the bathroom more than once or even at once for more than a 12-hour shift. That can have devastating results to nurses. Especially during this time, we're being told to keep going and to defer our grieving and processing of emotions that we are experiencing, often causing a negative impact for our own support system that is much needed. Burnout is a psychological state resulting from a persistent negative reaction to work-related stress. 3 dimensions are emotional exhaustion, feelings of cynicism, and a sense of being inefficient. These results can have a hazard to healthcare quality and patient safety. Research has shown that physicians who report signs and symptoms of burnout are more concerned about making medical errors. A result of almost 54,000 nurses from 6 different countries showed that higher levels of nurse burnout were correlated with lower ratings of patient quality care. When experiencing burnout symptoms, healthcare professions may develop a sense of detachment from work, both physically and psychologically. As the saying goes, it takes a village. Reducing healthcare professionals' burnout requires action on different levels. There's numerous proactive steps that leaders and organizations and units can take to prevent further damage to nurses' mental and physical well-being. This is an opportunity for organizations to provide a strong well-being program for their healthcare professionals, incorporating wellness activities, support avenues, and should be available around the clock. However, personal self-care is the most important step for well-being of nurses and providers. A study was conducted to determine perceptions of self-care strategies to combat professional burnout among nurses and physicians in a pediatric critical care setting. 6 of those strategies that were highlighted were finding meaning in work, what was my purpose of coming to work, connecting with an energy source, resources for support, including both at work and at home, nurture interpersonal connections, and able to inspire and motivate one another, develop an attitude of positivity, shifting their focus to look for the positive side in things, perform emotional hygiene, which included relaxation, sleep, diet, and exercise, and recognizes one uniqueness. What do they bring to the team? What are their strengths and what are their contributions? Mindful practice should be included in your self-care. This is a holistic approach that is associated with the mind, body, and spirit. There are 4 interacting components for the mechanism of action. Attention regulation, which returns focus to the main object when distracted. Body awareness, attention on the body's sensation to enhance attunement. Emotional regulation, having non-judgmental awareness of one's emotional response in the moment. Change in perspective of self. This arises from detachment from the view of an unchanging self. Providers in a program to encourage mindful practice in their life had a 44% dropout rate. They reported a lack of time and increased responsibilities as the biggest barrier to incorporate mindful practice into their lifestyle. This finding further underscores the challenges providers experience in prioritizing time for their own self-care. Finding ways to integrate mindfulness into the workplace, even in brief moments, warrants further research and exploration and practice. Some self-care ideas can include self-body scan, which is monitoring of body to increase awareness of sensations, sitting meditation, mindful attention to breathing with non-judgmental awareness of thoughts and distractions in the mind, yoga, which is breathing with gentle stretching, intentional activations of loving kindness, gratitude, and self-compassion. These things should be a daily home practice for 10 to 30 minutes a day, twice a day if able. There are no wrong ways to perform self-care. Whether if it's exercising, changing your diet, cooking, hiking, taking a walk, taking a nap, traveling, starting up new hobbies, or even just sitting outside for 5 minutes. Whatever it takes to take care of you, that is the most important thing.